Objective 4 ties to a great day in 2015 when Medicare began covering low-dose CT scans for smokers and former smokers at high risk of developing lung cancer. 8.6 million Americans qualify, but few are screened today. Lung cancer is the world's deadliest cancer. It's Minnesota's deadliest cancer. Recent studies reveal that participants who received the low-dose CT scans had 15 to 20% lower risk of dying from lung cancer. In theory, Objective 4 addresses the #1 risk factor in lung cancer, which is smoking. But the residual effects of this objective have tremendous power to touch all of society with increased awareness leading to earlier detection. And what we need is buzz! The smoking stigma is alive and well in this country. Even non-smokers report feeling judged and blamed for their illness. Does this help them heal? No. The stigma is directly linked to the 18% mortality rate. This stigma that keeps lung cancer in the shadows prevents important information from reaching those who are eligible for screening, and it perpetuates the shame that also keeps people from getting the screening. What we need is buzz. The most important elements in Objective 16 are to educate the public and expand public awareness. The residual effects of this education will be monumental in bringing facts about lung cancer to each and every person who has lungs. Tony's frustrated. She's met so many lung cancer patients, smokers, non-smokers who presented symptoms for lung cancer but were not screened until it was too late. Tony caught lung cancer early because she's a retired nurse and she knew her risks as a former smoker. It's important that we educate healthcare professionals about lung cancer screening guidelines, and with that education will come a general improvement in understanding the disease society-wide. Early detection is key to survival. Just ask Kurt. Understanding screening guidelines will lead to elevated awareness about lung cancer, and with this elevated awareness, Maria's fatigue, her shortness of breath, her shoulder pain, and her smoking history may have triggered a scan. To save lives, we need buzz. Thank you. Lori and Julie are a few of tens of thousands of women who never smoked and have lung cancer. Both presented classic lung cancer symptoms, but were diagnosed with pneumonia for quite a while. There's a growing caseload of women in their 40s and 50s being diagnosed, and Bonnie is another one. Works in our office. She's a never smoker fighting stage 4 lung cancer. Her family found radon at their cabin after Bonnie was diagnosed. And Bonnie didn't even know she could get lung cancer, so she didn't recognize the symptoms and didn't ask for help. Another way we can expand knowledge and help healthcare professionals determine who they should talk to about screening is to add pack years to smoking history. History that can save your life should be front and center, not top secret. Strategy, what is now 4.4, seeks to bring more information and more resources to populations that have higher rates of lung cancer. Sadly, disparities in healthcare have long been a problem in our country, and this includes information that could save lives. Here in Minnesota, we're so lucky to have Chris and the American Indian Cancer Foundation addressing the tremendous cancer inequities faced by the Native American community. Lung cancer is their leading cause of death. Quitline users, coming next year, will often meet the screening guidelines provided by Medicare. They represent a great first step in getting the word out about screening programs. This particular strategy addresses a valuable way to get important information about screening to people, especially smokers obviously, who are motivated to quit and concerned about their health. Quitlines are excellent smoking cessation programs available in every state. Denise is one of many former smokers that was successful in quitting cigarettes. Had she been informed about screening while she attempted to quit smoking, she would have gladly grabbed the opportunity and probably avoided a stage 4 diagnosis that turned her life upside down. Julie had quit smoking a year before her diagnosis. She presented classic symptoms but was never screened. When she became sick, she was diagnosed with pneumonia. Being 36 years old, she and her family were shocked when she got the stage 4 diagnosis, and she died 18 months after little Blake was born. And finally, Kelly is the inspiration that drives me and the staff of a Breath of Hope Lung Foundation. She had obvious symptoms and was misdiagnosed over and over, giving the cancer time to progress. Kelly died at age 27, just hours after exchanging vows with her soulmate from her hospital bed. And a better informed society may have saved her life. Objective 4 is a great first step in our larger goal of finding lung cancer while it's still treatable. And what we need to change the 18% survival rate is... Thank you.